Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you from a grant from the Rosalie and Jerry Exline Ziegler Fund. And welcome, and I got one of my favorite guests and colleagues, Crystal Tallman. Welcome, Crystal.
Thank you very much.
So Crystal grew up in Illinois, but she became an Iowan, maybe almost 20 years ago. Went to Iowa State, majored in, so your undergraduate degree is
in dietetics and Spanish.
Dietetics and Spanish, so double major. And then went on to get your master's. And Crystal has been one of our oncology dietitians at Mercy Cancer Center for the last 14 years. Yeah. And a dietitian, nutrition services are just essential to cancer care. And so it's been great to be a teammate with you for 14 years.
Yep.
So go Cyclones and go Jackrabbits, by the way. I don't know if you've been keeping. Yes. Yeah. So that's South Dakota State, by the way. So what interested you in going into nutrition, diet, becoming a dietitian, and then the Spanish? Was that always along the way, or did you pick that up as you were in college?
Yeah. So when I was in high school, one of my good friends and I, we had an off season in our sports. And so we decided to start running and eating healthier. And we both lost weight and just kind of transformed. So that really got my interest going in dietetics. And I'd actually never heard of the major or the profession until my freshman year of college, when we were at a family Thanksgiving, and one of my cousin's wives was a dietitian. So she kind of led me into the career path. So I was on that ever since. And the Spanish, I've always loved different cultures and traveling. And so that's kind of a nice addition.
Have you been able to keep up on your Spanish skills?
Not very well.
Okay. But you just shared with me that you're going to have an opportunity to do.
Yeah. My husband and I are going to Colombia next month for a friend's wedding. So
Wonderful.
We'll get to practice it a little bit down there.
Great. Yeah, that whole studying of food, nutrition, but then the clinical specialty of being a dietitian. Can you maybe put that in perspective, the various educational opportunities one has to study nutrition, and then what it means to actually be a licensed dietitian?
Yeah. So so our schooling requires a bachelor's as a minimum, and then in I think a couple of years they're going to start requiring master's as a minimum education, and then we have to do an internship after we graduate, and then pass a national exam to become a registered dietitian. So in our internship, we're exposed to different areas of dietetics, which would be the clinical or like the hospital setting, community, or which would be a lot of sports dietitians would be kind of in that area. WIC, some outpatient clinics would fall into that, and then food services, where other dietitians are employed. I've just been interested in the clinical aspect, and I love my job because it really spans the clinical and the community aspect, where I can, do things like this. I can do presentations, but then I also get that one-on-one with patients and get to kind of dive into disease states and how to help them work through their diseases through diet.
So obviously we're fortunate to have two dietitians in oncology. I would imagine endocrinology, or people who deal with diabetes, might have dietitians on their staff. Yep. What other medical specialties have the luxury and benefit of having specific dietitians to help them with their services?
Yeah, so unfortunately, from an insurance coverage perspective, the only areas that are covered for dietitians are renal, so we'd see a lot of it there, diabetics, and weight loss or obesity management. So those areas are covered for insurance, so you'll for sure see dietitians in those areas. Gastroenterologists, obviously there's a lot of need in GI diseases, so that would be an area for dietitians as well. And then
and I would imagine, when you speak broadly about prevention, heart disease, and we'll talk a little bit about the diets. One thing that I think is good is that preventing pretty much every chronic disease, the diets are pretty much similar.
Absolutely.
Yeah.
It all kind of boils down to the same concepts,
Yeah.
So when people come in with multiple chronic conditions, there is a lot of overlap with recommendations. Now, there's going to be obviously different tweaks based on if you have, let's say someone who has kidney disease is going to have some more restrictions in their diet than someone who might have heart disease. But overall, the general concepts are going to be pretty similar.
So we are what we eat. So obviously what we eat is really important. In the world of oncology, maybe I think of maybe 3 buckets that we might want to talk about. One is how can we use healthy nutrition to prevent cancer, and maybe the relationship between our diet and cancer. And then second, maybe that situation that we sometimes experience where patients are going through cancer treatment that significantly affects their ability to get normal nutrition, and the role that a dietitian can play in helping support patients during their cancer journey. And then maybe a third area would be how can dietitians help those that are done with cancer treatment and maybe wanting to look at how they can be as healthy as possible.
Yep.
So let's start with the role of diet, nutrition, the role that it plays in actually causing cancer.
Okay. Well, more and more recently, they're finding that overweight and obesity is linked with cancer. It's the cause for 13 different types of cancer. Some of that is just due to hormonal changes in the bodies. Sometimes it's due to physical changes in the body. So, for example, someone who tends to carry more weight in their abdomen are at higher risk for reflux, or that can cause reflux, which can increase the risk for esophageal cancer. So you can see there's kind of a lot of different reasons that obesity can increase the risk for different types of cancer. So that's one area that we can kind of tackle and kind of jump into is encouraging people. And unfortunately, with how our society is set up, is we're not very prevention oriented. It tends to be more reactionary. And so the nice thing is, if we're talking about cancer prevention from a diet perspective, there's a lot of overlap between our cancer survivorship nutrition. So when people are done with cancer treatments, we would tell them very similar things to prevent their cancer as we would someone who's never had a cancer.
And you raise a good point. People sometimes aren't concerned about a diet to prevent cancer till they've already had cancer.
Exactly.
And it's like, okay, wake up. Now I know I've got cancer. Now, how can I prevent a future cancer? Yeah, and people don't come to the cancer center to learn about how to prevent cancer if they've never had cancer.
Right.
So that education probably needs to happen in grade school or preschool, or to the mom that's pregnant before the delivery ever happens.
Yeah, no, I agree. And I've found that people tend to associate cigarette smoking or tobacco usage and alcohol with increasing cancer risk, but it doesn't seem like a lot of people recognize the connection between diet and exercise and lifestyle choices with that increased cancer risk.
Yes. And you're absolutely right, especially if we often talk about this triad of obesity, physical inactivity, and too many calories, or the wrong type of calories, is the triad that is almost as significant in causing cancer as cigarette smoking.
Yeah.
So continuing on the theme of how we can help someone prevent cancer, either someone who's never had cancer, or let's say someone who has gone through cancer treatment, is now cancer-free and wants to get serious about doing everything they can to reduce the risk of having a future cancer. What's the best diet?
Yeah.
For those of us who want to prevent cancer?
So the American Institute for Cancer Research, or the AICR, is a really great organization that they take a lot of research on diet and exercise and the associations with different types of cancer. And so they put forth different recommendations for each cancer type. So, whether someone has colon cancer or breast cancer or like a pancreatic cancer, there are going to be specific recommendations for each type of cancer that people can go to their website and look at. But if we're speaking in generalities, the AICR also put out recommendations on what people can do to reduce that risk. One of the things is to reduce the intake of red and processed meats. So red meats would be anything including beef, pork, and lamb, and they generally recommend consuming less than 18 ounces of that per week. So kind of translating that into portion sizes, a deck of cards is 3 ounces. So essentially looking at no more than 6 decks of cards over the course of the week of the red meats. They also recommend avoiding or really limiting processed meats. So that would be anything like bacon, pepperoni, lunch meats, sausages, things like that.
Mm-hmm. Is that carved turkey that you get in the deli, is that lunch meat, or would that qualify as a healthy meat?
Yeah, that's a good question. So we would say that would be considered a processed meat. So generally, if you can buy something like a turkey breast or a chicken breast and then slicing that down yourself, that's going to be the best way to consume it, because it's not going to have those nitrates, those preservatives like you would get from behind the deli counter.
Okay.
So limiting or avoiding those. Also making sure that people eat a diet rich in whole grains, fruits, and vegetables, and really going for a plant-based diet. So I think when I say the term plant-based, people freeze up and like, well, I can't give up my meats. Plant-based does not mean that you have to go vegetarian or vegan, that you have to cut out meats. It just means that when we're looking at a plate, we want about 3/4 of it to be a fruit, vegetable, or whole grain, and that other 25% to be the animal product. So whether it be a dairy product or a meat, a lean protein.
And you did mention to limit your red meat, which you defined as beef, pork, and lamb, to 6 3-ounce servings, and a 3-ounce serving is about the size of a deck of cards. Is there a reason to limit the number of ounces of like chicken, fish, or turkey? Do you have in terms of a healthy diet, is there a limit to how much of that protein?
No, as long as you're choosing like lean options, not not frying those. I haven't heard any recommendations or limits on those specifically.
But again, for any given meal, you'd want to have that deck of cards of protein, deck of cards size of protein, with whole grains and vegetables and fruits.
Absolutely. Okay. And keeping in mind that, oftentimes people think, well, beef and pork are superior in terms of the amount of protein that they contain compared to chicken or turkey or fish. If you compare similar portion sizes, they all have fairly similar amounts of protein. So don't feel like you are lacking on your protein consumption if you do choose something like a turkey or chicken, because it's going to be fairly comparable to.
And someone can be a vegetarian or a vegan if they know their nutrition, can still get all the protein they need.
It just means you have to be consistent and diligent with kind of pre-planning meals. But yeah, you can definitely meet all your needs.
Yeah. Let's talk a little bit more about whole grains and then the role of starch and carbohydrates, and kind of how we've changed our thoughts about healthy eating over the past 30 years related specifically to carbohydrates, maybe.
Yeah. So probably carbohydrates are the macronutrient that I tend to get the most questions about, because carbs are demonized in the society, and people think weight gain is associated with carbs and they need to cut carbs out to be healthy. And really, we just want to make sure people are choosing the right types of carbs. So carbs, protein, and fat all have different functions in our bodies. Carbs' main purpose is our energy source. And so we want, regardless of if you've had cancer or not, we want people to be getting about 50 to 60% of their calories to be coming from carbs. When we're talking about whole grains, we want at least half of the grains that people consume to be whole grains. So that would be something like brown rice, wild rice, whole wheat pastas, whole wheat breads, those types of things. We want to really limit the more processed, like the white products, the white breads, the white pastas, the white tortillas, and really emphasizing the whole grains. The difference is that whole grains have the entire grain included in it, whereas a refined grain has the bran stripped off, and so that loses fiber, and you'll lose different nutrients, different vitamins with that stripped off.
Where do potatoes fit in to this conversation about carbohydrates, whole grains? Is there something inherently bad about a boiled white potato with a little butter versus a yellow potato or yam? I mean, are they healthy? Are they on the bad list? Are they on the limited list? Where do potatoes fit in?
Yeah, I'd say probably limited. Keeping in mind the more color a fruit or vegetable has, the more nutrients it contains. So if you compare sweet potato to a white potato, you'd be getting more nutrients out of the sweet potato. If you can have the peel because that'll have a little bit more fiber to it. And just keeping in mind that potatoes do have nutrients. They're a good potassium source, which especially for people going through treatments, it can be beneficial to have that. But other than that, there's not a lot of nutrients to it. So making sure that we are just limiting the potatoes and making sure that, typically when people have potatoes, they have butter or they have sour cream or they're fried.
Right.
So just making sure that we're.
And once we get to French fries and potato chips, those clearly are potatoes, but you're probably
that's not the whole food we're looking
in
for.
The red danger.
Exactly.
Very limited.
Yep.
Okay. Are there other vegetables that fall in the limited category, as opposed to some vegetables? I would imagine there's no limit in how much celery you could eat.
Correct. I'd say the main other ones that jump to mind would be peas and corn, just because they're going to be starchier like potatoes would be.
Okay.
So they don't have as many nutrients, and so just making sure those are limited.
What are the most nutrient-dense, good vegetables?
Sweet potatoes, any types of greens, tomatoes, really anything with a deep color is going to be a pretty good. So most vegetables.
And they're cruciferous, are they?
Those are going to be great options,
Yes.
especially
Broccoli.
Broccoli, cauliflower, Brussels sprouts. Cruciferous vegetables are those with heads to them. Studies have found that, especially in breast cancer, that those tend to be especially beneficial, regardless of how a woman consumes them. So whether they're cooked, whether they are raw, what those do is they bind to cancer causers in the body and help the body get rid of them. And so when I work with women with breast cancer or people with breast cancer, I'd recommend trying to have at least one serving a day if they can, or at least 3 to 4 servings a week if they can't do it daily.
Okay. What about fruits? Some are pretty sweet. Are they always healthy? Are some on the limited side? What are go-to fruits that you can't eat too much of, and what are fruits that maybe are healthy but in limited quantity?
Yeah, I think the most important part is just making sure that you're getting a diversity of fruits of fruits in there, and not just emphasizing apples and bananas. Tend to be the most common ones that I see. But make sure that you're getting things like kiwis and berries and citrus products, and just getting a good variety in there. Again, they all have different nutrients. Each color that the fruit is signifies it contains different nutrients. So just trying to get a rainbow of colors on the plate.
And then fats. Obviously, fats are an essential, important ingredient, and sometimes fats get demonized. And what's the current thinking on how much fat you should have in your diet, and what are the healthiest fats, and what are fats we should avoid or use in limited amounts?
Yeah, so fat should be so I said carbs should be about 50 to 60% of calories. Fat should be about 25 to 30%. So about a quarter to a third of our diet should be coming from fats. And this kind of has a connection with cancer, but we really want to make sure that we're choosing healthy fats because those are considered to be anti-inflammatory. So things like avocados, nuts, seeds are going to be great fat options, olive oil, canola oil would be a good option. The fats that we want to limit to avoid would be animal fats, so things like lard, butter, watching fried foods, not really doing those. Those are inflammatory type foods, and they're also finding that cancer is a state of the body being in chronic inflammation, and so the more that we can kind of influence that part of our body by adding anti-inflammatory foods in, that can potentially kind of alter the inflammation in our diet, inflammation in our body, which might reduce that cancer risk.
And what about fish oil? And I would say fish oil in its natural state, like a piece of salmon, or fish oil as a supplement.
Yeah, so I always encourage people to get it through foods if they can. And so fattier fish like salmon or tuna, mackerel or herring, anchovies are going to be really good options. Leaner fish, so things like cod, tilapia, orange roughy, those are going to be good options. They're just not as concentrated in the fish oils. For people who don't like fish oil supplements can be okay to do. The most research is looking at supportive of them reducing triglycerides, which are the fats in our bloodstream, and then potentially reducing cholesterol as well. Okay. I wouldn't say it's something that everyone has to do, but it certainly can fulfill a need for some.
So I've never seen, we use oils like in bottles, and obviously you can get olive oil and you can get avocado oil and you can get obviously butter and you can get lard. Those are animal oils that you get. Does anyone make a fish oil that is like a dietary ingredient as opposed to fish oil capsules? But
I've seen them in gel form, but I've never seen them in like an actual oil.
Just wonder whether there's a reason. I mean, there's other animal fats that we use, like lard or butter, that we use to add to foods, but
I'm thinking. No, I've never seen it, but I'm wondering if so many people can have like the fish burps or things like that with the fish oils. I wonder if they were to do it in like an actual oil form, if it'd be even tolerable.
Like a salmon oil.
Yeah, right. I don't know if it'd be even tolerable by most.
So, what else would you like to say about diets that are good for preventing? And maybe the term Mediterranean diet is commonly used, like, oh, you should eat a Mediterranean diet. Where does that phrase come from, and what does it actually mean?
So it comes from the diets of the people who live around the Mediterranean Sea. So it's just centuries of research have found, or centuries of eating this way have found, that these people tend to have, lower risks of all these kind of chronic conditions. So when people ask me the best diet to follow, I really don't like the term diet, because I think when people think of diets, they think of them to be very restrictive. But if I were to push anyone toward a specific diet, the Mediterranean diet would be the one that I would do.
Maybe we just call it a Mediterranean eating plan.
Absolutely. Yep. And that's the way that Barb and I tend to approach eating, is we want to make sure that the way people eat is something that they can sustain for their whole lives. And I think even just that term diet signifies it can be temporary, whereas if you have like an eating plan, that seems more of a long-term thing. But the Mediterranean diet is going to be more of that plant-based diet that we talked about being helpful, focusing on the healthy fats. It works exercise into they have a Mediterranean diet food pyramid, and that's on there as well. And just emphasizing like plant proteins, so things like the beans, the nuts, the seeds in there are on there as well.
Okay. So other diets or eating plans that you hear about, low carb or ketogenic. What's the word keto mean in talking about an eating plan?
Yeah, so ketogenesis is the state where basically the body converts to using fats for energy. And so it's a diet where it's very, very restrictive, and it's very heavily, I think it's like 85% of calories are coming from fat. So again, 25 to 30 is recommended. So this is a very high fat diet, moderate in protein, and very low in carbs. So for comparison,
so you're kind of forcing the body to use fats instead of carbs.
Right.
Kind of the natural state of what we would normally eat if we were just out there not paying much attention would be high carb, and the carb is used for energy. So this is like artificially, or intentionally, I should say, restricting your carbs.
Yep.
To kick your body into,
because it's used for weight loss generally. Yep. Okay. Yep. And so it can be effective for weight loss, but we just tend to find that people who do it generally struggle with maintaining it for the long term, because it is very different than the normal diet. And people have to be very intentional with, making sure that their whole diet isn't bacon and butter and, because those are the high fat foods, but we need to make sure that we're getting healthy foods in there as well. So it can be done, but it just requires a lot of work that most people just struggle with. They don't have the tools to be able to do that. So when people ask me about keto diets, it's not something we generally recommend. Again, for one of the main reasons being that carbs are fruits and vegetables and whole grains, which we know have those anti-cancer properties that we just haven't seen on like, they're just not possible on the keto diet.
Okay. So in the general conversation we're having about eating plans, healthy eating, and eating plans that reduce the risk of cancer, does sugar cause cancer?
So that's probably the most common question that I get asked. And an easy answer to that is no. And I'll kind of explain that. And so a lot of the thought on why sugar causes cancer is by how PET scans function. Most patients get PET scans as part of their treatment workup, and it's because they're injected with a radioactive glucose tracer. That tracer goes around their body, and then it kind of lights up in the area where there's cancer. So people see that and they think, oh, well, the sugar went to the cancer, so therefore sugar feeds cancer. But that just really oversimplifies how the body works. The body is very complex. And so if people are up to it, I kind of jump into a little bit more explanation behind it. What they're finding more so than the easy sugar feeds cancer is the connection between insulin and cancer. So as you know, insulin is a hormone, and it is released proportionately to how many carbs we consume. So I give the example, if you consumed an apple versus applesauce versus apple juice, the apple is the most whole form. It's got the fiber in there. It's a whole package. Applesauce is more processed, and then the apple juice is the most processed. It's the most concentrated source of sugar. So all of those when consumed will have an insulin response. The apple will have the least, applesauce will have the next most, and then the apple juice will have the most. Well, insulin's a growth hormone, which is good. I mean, we need that for our normal healthy cells, but then it can also be a growth hormone for cancer. And so what we find is that when people are constantly having a lot of plain sugar in their diet, and they're having those constant insulin productions in their body, that can potentially be the connection with the cancer growth. So if we boil that back down to kind of an everyday diet, what I would tell people to do is make sure they're having a very well balanced or a very good balance to their diet. So not having, a day of all simple sugars. So not having like a breakfast of donut and orange juice, not having lunch of a sandwich with potato chips and a cookie and a pop, and then a supper of pasta and garlic bread and a milk. Like it's all carbs. There's not a lot of balance to it. So all of those, because they are white products, they're refined, they have a lot of sugar, so we're having constant insulin surges with all of those meals. If we add balance to that, that's going to reduce the insulin surges. So if we are having carbs, make sure we're having fiber or protein with it. So for breakfast, maybe have some toast with some peanut butter on it and an apple. And then lunch, have maybe a tuna fish sandwich, some black bean soup, or a salad on the side. And then supper, maybe do a grilled chicken with some broccoli and some rice. There's a lot more balance to that. And even though you've got carbs in there, we have that protein and the fiber and the fat to reduce that blood sugar response, or reduce the insulin response, which is going to reduce the blood sugar response.
So good balance, and any carbohydrate, once it's reduced down, I mean, we can't eliminate sugar, but having less of the highly refined sugar,
absolutely,
that causes such a big insulin boost.
Yep. So what I tell people is fun foods are part of life. We need to have the fun foods in there. So, if you are someone who wants chocolate in your diet, have it with some nuts. Do something like a trail mix where you've got some nuts in there, or work some peanut butter in, or cheese and crackers, where you just have some kind of protein with that carb to reduce that blood sugar response.
So let's shift gears now and talk about the role of oncology dietitian in helping support patients that are going through some difficult treatment, and let's just say chemotherapy and radiation therapy in particular, where they might have had a normal body weight, or maybe even some excess weight, but now they're going through a treatment that might last 6 months, where they're getting hammered with chemotherapy, radiation therapy, surgery, and are experiencing considerable weight loss because of the inability to get in enough nutrition. Talk about your role as an oncology dietitian in supporting patients that are going through active cancer treatment.
Yeah, so we recognize that obviously cancer treatments are very rigorous, and even with the best of intentions going in with eating a really like a perfect diet or a good anti-cancer diet, even the most motivated people can really struggle depending on the treatments and what the side effects look like. So Barb and I and other oncology dietitians, we work to help people manage their side effects from a diet perspective. So, you've got the nurses and the doctors helping, tweak medications and tweak that aspect to help manage their symptoms or help them. We give suggestions on how they can alter the foods or their beverages, the timing of things to help work with side effects. So whether it be GI side effects where they're nauseous or vomiting or having bowel changes, whether their appetite's down, whether their tastes are changing, if they're on feeding tubes. We work with all of those patients to try to give them suggestions on how they can work with those and minimize those as much as possible. And we always say, like, diet's one piece of this, but this is just in support, use your medications, but we need to make sure that you're doing what you can from a diet perspective to help, minimize things as well. So we meet with them the first time. And, we've worked here long enough where we have a pretty good idea of, if they're getting radiation to a certain site or getting certain chemo drugs, we have a good idea of what side effects to expect, timing of those side effects when they would be hitting those. So we can kind of lay out a plan for them, and we have an idea in mind of when we might expect to do certain interventions. So the first time we meet, we get just a good baseline. What's your normal intake? Are you a 3-meal eater or 3-meal-a-day eater? Do you snack a lot? Are you good about drinking water? Do you have enough food in the house? Do you have, working stove and things like that? So all of those things. Do you have people who can cook in the home? Do you have to rely upon convenience foods? All those kind of factor into suggestions we can make. Obviously, high calorie, high protein foods are going to be, generally speaking, the most helpful for most people. So we try to get a good idea of higher protein foods they like. If we know that they're going to have issues with swallowing, get an idea of softer foods they like. Just kind of laying that groundwork to make it easier for when they have those side effects, so we can kind of revert to those suggestions when the side effects crop up.
And is there a role for nutrition supplementation for those patients that are having a difficulty getting in enough calories?
Absolutely. I think they're definitely not our first suggestion, because we know most people just would prefer to have food or their normal beverages. And so that's always going to be what we tweak first, give them suggestions how they can bump up calories for what they're already eating, how they can bump up protein. But if those suggestions don't work, and if that's still not meeting their needs, then there's definitely a need there's a role for supplements. So whether it be more of the well-rounded supplements like the Ensure or Boost or Carnation Breakfast, or if they need like protein-specific recommendations, might be different powders or drinks. There definitely can be a role for some people.
Okay. Let's shift now to individuals that have been diagnosed with cancer, are now through with their cancer treatment, and they're motivated to want to have the healthiest possible lifestyle. And how do you counsel those patients that are now cancer survivors? And is there any difference in the way you would counsel them compared to the general population of individuals who've never had cancer?
So the recommendations are going to be similar, regardless of if you've had cancer or you haven't. I think the one difference would be, do they still have lingering side effects from their treatments? We have people who've had taste changes that last for a long time afterward. They might have salivary changes. Their appetite still might not be as good as normal. So those are all things that I think are going to be more specific to the cancer survivor. But other than that, no. Again, it kind of goes back to the AICR's recommendations for cancer prevention, it's going to be the same regardless of if you've had a cancer or if you're looking to prevent a recurrence or a second primary.
Okay. And some patients that have come through cancer treatment might be on ongoing treatments. So, for example, I think of breast cancer patients who might be on an anti-estrogen for
Sure.
10 years, or in men with prostate cancer who might be on an anti-testosterone. Are there certain foods that certain individuals should absolutely avoid or should absolutely include in their diet based on the type of cancer they were treated for, or the type of treatment they're receiving, such as tamoxifen or Arimidex or Lupron or those sorts of hormone therapies?
So I would say if I had to kind of whittle it down to one group, I'd say probably the cruciferous vegetables would be pretty advantageous for breast and prostate patients, to kind of go off of your question. Those are going to be beneficial. Soy products can actually be helpful in both those populations as well. And again, more of that plant emphasis is going to be important for those types of groups, or those groups as well.
Okay. You mentioned soy products, so that question comes up sometimes, and maybe we'll put that in the broader concept of phytoestrogens. So, are there foods out there that contain estrogen, and are they helpful or harmful? And what's the guidance you would give an individual? And mostly I'm getting these questions from patients who have breast cancer.
Yep.
What's your thought about phytoestrogens and soy for women who've had breast cancer?
Yeah. So I would say that women who had specifically the ER positive breast cancers tend to have this question, and it is safe for them to have whole soy foods up to 3 servings per day. So that would be soy milk, soy yogurt, soy nuts, tofu, edamame, miso. Most of the studies of soy are coming out of Asian cultures, where that tends to be much more prominent than it is in the US. And they find that those populations tend to have lower risks of breast cancer. And so here in the US, actually most soy is consumed through processed items because soy is a cheap filler. And so making sure that we're just trying to limit processed foods again. So for that population, I would say, yes, it's safe to do. It actually might reduce the risk of breast cancer. So for women who have girls who are prepubescent, so before that their breast tissue has developed, soy products can be beneficial in that population as well, and potentially reducing the risk of developing breast cancer later on in life.
Is tofu a processed food? Is it
It'd be considered a whole soy food?
It is.
It is
So it's not like the soy version of lunch meat.
No, it's not.
Okay, so tofu would be okay.
Yeah, it'd be fine.
Okay, very good.
So you use the term phytoestrogen. So phyto means plant. So where phytoestrogen comes from is plant estrogen. And soy has that, and that's where there's confusion, but the difference is that estrogen, the phytoestrogens, are not as strong as our human estrogens. And so because the terminology is similar, there's a lot of confusion around that. But knowing that soy is going to be okay to do. Foods do not contain estrogen. No foods contain that. And so in that sense, that food is not going to fuel cancer growth in that population.
So I think I'm hearing you say that you really don't have to worry.
Correct.
About that. If you have an estrogen sensitive cancer, you do not have to worry about phytoestrogens, and you don't have to worry about soy, and that soy is a healthy type of way of getting proteins.
Correct. When it's consumed in the whole form.
Right.
The one caveat to that would be I wouldn't recommend soy supplements for people who have had ER positive cancers. And for people, I've had patients who have been
And by soy supplements, are you talking like protein powder? Is sometimes that's made out of soy?
Yep. So we wouldn't want them doing soy protein powders. Right. So whey protein's okay. It's different. Soy protein powders, we wouldn't want them to do soy protein bars.
to argue, but are you saying that out of an overabundance of caution, or are you aware of any study that shows that soy protein supplements causes cancer?
So when you strip it down, so you take it out of the context of the whole food and you strip it down to that processed soy product, it has more of a concentration of the isoflavones. And isoflavones are part of the soy that can have some of that activity, which could potentially lead to cancer growth. And so I would say it's kind of an abundance of caution, but also there is some studies supporting it. There are also, like, we've had patients who have needed to lose weight after treatment. So they've looked into some of those commercial weight loss programs where you're on bars or shakes or things like that. A lot of those are soy-based products. Those are products that we would not recommend that those patients do those types of weight loss programs because it has that concentrated soy item in it.
Okay. What are some of the myths that abound about food and nutrition?
Oh gosh, you just hit a couple of them. The soy and the sugar feeds cancer are probably the two of them.
Butter, where's butter now? I was a little just brokenhearted when you mentioned put it in the bad category, because I thought
in moderation.
I thought butter and eggs had moved from evil back to healthy.
I'd say they're if you put foods on like a red light, yellow light, green light, they're probably in the yellow light. Okay. Like you don't want to, you don't have to avoid them.
Egg whites are all green.
Yeah.
Egg whites are green. Egg yolks yellow.
Probably yellow.
Okay. And butter yellow, not red.
Right.
Okay. Yeah. So we're moving back to.
So another, I don't know if this is a myth, but maybe you could classify that is that I need to go all organic with my fruits and vegetables consumption. I would say organic can be beneficial, but from a cancer standpoint, the most important thing is actually consuming the fruits and vegetables. So most studies have been done on conventionally grown items. There aren't any large-scale study on organically grown fruits and vegetables, and they found that the more fruits and vegetables people got in, the more protective it was, even if they were conventionally grown. And so, what I would encourage if people want to do organic, obviously everyone's budget's different, and we know organic tends to come with a higher price tag. And so, considering the budget, if budget's unlimited, feel free to do as many organic as you want. If budget is pretty tight, if you really want to go organic, I would say go for things that have peels to them. So things like, let's say, melons or bananas, or things that you don't eat, because that pesticide wouldn't penetrate through those peels necessarily. So you wouldn't have that chemical exposure by the consumption of those. Otherwise, if your budget could kind of go either way, I would make sure that you're getting fruits and vegetables that have a thin skin to them. So things like berries or
so the things where we eat the skins go organic. The things that we don't eat the rind, like a muskmelon, nobody eats the rind of. Well, I shouldn't say nobody, but generally we don't. And so the inside of a cantaloupe or muskmelon, you're probably wasting your.
Conventionally grown is fine. Yep.
Okay. Well, let's open up to questions here. All right, we got a live studio audience here. They're very alive. And then we also have a live streaming audience. And those of you that are watching us live streaming, you can put your question in the chat box.
Okay, you mentioned eggs having in the yellow category for the yolk. Is there a limit as to how many per week a person should have?
I don't know on the per weekly basis. I think it's. I'd have to. I'd have to
per day. We'll do the math.
Yeah.
How many eggs can I have a day?
I know, but it's not something you can binge. Gosh, the American Heart Association puts out those recommendations, and I'd have to refresh my memory. It's 1 or 2 a day, but I can't remember which one it is.
Okay, so I can look up the American Heart.
Yeah.
Yes. Yep. Ghee and coconut oil has come into the picture the last 10 years or so.
Is coconut oil good or bad?
And ghee also.
So coconut oil, it's technically a saturated fat, which from that classification, that would fall more into the kind of butter route. But it's a different type of saturated fat. And so I would say I would not have that be the only source of fat, because it's not as good as like an olive oil. But it's not like a lard. I'd say it's probably in the middle. So for something like that, it's something that I would maybe use interchangeably with other oils. So maybe a little bit of coconut oil with some types of food preparations, olive oil with others, canola oil, and just kind of alternating between those.
And you mentioned ghee.
Yes.
So ghee is clarified butter. Is that what ghee is,
Yes.
right?
Yes.
Yeah. I don't know a whole bunch about ghee. I'm sorry.
It'd probably
Good
be
question.
the same as butter, though, right?
Probably.
Yeah.
Yeah.
So, and what else? Maple syrup versus sugar.
Okay.
I use maple syrup to bake instead of sugar. How is that?
Yeah, so that's a good question, because I get that question, and I also like, agave and honey and other types of sugars. The body breaks them down, and they all kind of look the same to the body. And so I don't think any of those are necessarily any better, more of just watching how much of it you consume, and just keeping in mind that things like maple syrup and honey, even though they're more natural, maybe necessarily, than table sugar, it's not necessarily any better for you.
Okay.
I have two questions. First of all, what about legumes? Are they good for you, or how much of that should you be having?
Yes, those are good options for you. They have good fiber options.
And is there a difference between the types of legumes? Are there some that are better and some that you should limit when you get into the world of legume? And maybe for those who might not know, define a legume and list examples of legumes.
Yeah. So I think of legumes to be things kind of like beans almost. And so I would say that those are all going to be good options. They have good insoluble fiber to them. They're good for constipation, good for helping keep the bowels moving.
And does a soybean actually fit into the category of legumes?
I don't know.
Okay. My guess is it does, but I'm not positive. Yeah.
And I have maybe a practical question.
Yeah.
Let's say I'm a cancer survivor. I'm all done with my chemo or surgery and things like that. And I go to you to say, okay, what should I be eating? And then you go through this wonderful presentation to them to say, this is all the great foods that you can have, and et cetera, et cetera. And then they come back to you and say, but I like my chicken McNuggets. Mm-hmm. What do I do? What are some of the tricks of the trade that you do as a consultant to that post-cancer person to convince them to try to go to?
Yeah. So I think what you're asking is really the behavior modification. So you taught them everything and they can get an A+ on the written test, but then they leave your lecture and stop at McDonald's on the way home.
Yeah.
Even though they know it's not on the. So do you have tips on how to actually help patients be successful in doing what they know they should do?
Yeah, no, that's a great question, because I oftentimes hear people say, I know what I need to do, but we know it's much more than head knowledge with making changes. So where I would start with them is asking what they're willing to do. This is not my journey. My role is to help kind of walk alongside them. This is their journey, and I want to support them. And so they know what tends to be what they think the easiest change might be. And so we've got to start somewhere. So if you wanted to use the example of going to McDonald's and getting the chicken nuggets, well, what can you have on the side with that? Could you have your chicken nuggets and can you have a salad with that? Or could you have some fruit with that? Or could you do a 4-piece nugget versus a 6-piece? There's ways we can tweak it where you don't have to go from 0 to 60 overnight. It's all about, I think behavior modification is all about making gradual changes over time. So I would first start off with what are they willing to do, what small changes they can make, and then having them set the goal. I'm not going to set the goal for them, but having them do that. And then letting those changes snowball. So let's say you say, well, I can add a fruit in with my chicken nuggets. Well, great. We'll do that. And then like a week or two later, we'll circle back and, see how you're doing with that. And then, if you're doing well with having incorporated that fruit in, well, then what's your next step you're willing to do? Can you add more fruits or more vegetables into other meals? Are you able to walk more? Are you willing to walk more? Are you more consistent with adding water in? Are you cutting back on sugary beverages and replacing it with water? I mean, there's lots of things that we can tweak. And I think it's all about figuring out what you want to do, and then having you build some accountability in for yourself. So whether it's having an accountability partner, someone willing to make changes along with you, whether it is writing things down, food journaling, some people take pictures of their meals, just something where you have that visual feedback to yourself to help keep you on track. And then having little goals kind of rewards for yourself along the way. So we know behavior change is not easy and it takes time. And so making sure that you have little fun things every 2 weeks, every 4 weeks, whatever, to look forward to. So nothing food related in terms of rewards, but, maybe if after 4 weeks of making set changes, you treat yourself to going to a movie you've wanted to see, or to meeting up with a friend you haven't seen in a while, or whatever it might be, but just something fun and affirming, that's something to look forward to, but then also will help keep you on track with your lifestyle.
All right. So you need to walk to McDonald's for 2 nuggets and then walk home.
That works.
So, yes. Other questions? Chris?
You mentioned water.
Yeah.
How much water should we be consuming on a regular day? And I've also heard the term used of superfood.
Yeah.
Could you address what is a superfood and should we be eating those?
Yeah. So in terms of water consumption, I'd say most people are told 64 ounces a day, which would be 8 cups of water or 4 water bottles. I think that's a good starting point, but depending on physical activity level, if you're in treatment, that number, or male, female, body size, 64 ounces is kind of a good starting point, but then I would increase or decrease that based on who I was working with and their individual needs. I'd say most people that I work with during treatment have much higher needs than 8 cups a day. It's probably closer to 10 to 12, depending on what they're getting. So superfoods. I think that the important thing is just getting the variety in there. When people tend to think of superfoods, they tend to think of fruits or vegetables more than likely. Salmon would probably be considered that. Nuts, things that tend to be pretty concentrated in nutrients. When I think of superfoods, I think of things like salmon and nuts, olive oil, berries, spinach, and other greens. Those where you just get a lot of bang for your buck out of the food you're eating.
How about kale?
It's a good option if you like it.
Okay. That's kind of surged onto the scene a few
Yeah,
years ago.
yeah. Yeah, you can have that. You can make it into kale chips. Some people like that. Kind of takes some of the bitterness away. Some people cook it. Some people just eat it raw in salads.
Other questions?
We've
George?
got a question from viewers. Angelina is watching, and she says, can bacon be eaten in moderation as a cancer survivor at all? And I guess the question would be, what's moderation?
Yeah, that's a great question. So bacon is one of those foods that would be, if you're looking according to like the AICR recommendations, that would be one of the foods to avoid. I don't think it's realistic, especially in Iowa and the Midwest, to tell people to avoid those. So if we're looking for like practical recommendations, I would say try to limit it to maybe once a week or something like that, where it really is just more of a treat type food than something that's part of the everyday.
Kind of think of it like a candy bar.
Yeah. Yep.
Yeah, it's a treat,
Mm-hmm.
not a 3 times a day. Okay.
Hey, Kevin.
Kevin?
Yes, as a patient of yours, I can say your advice and the counsel is extremely helpful, critical, and essential.
Thank you.
Where I am now, I lost a lot of muscle mass, and I've been going to the gym.
Mhm.
If you hang around a gym, you'll see there's a lot of protein consumed in a gym itself
Yep.
because there's the belief that, it has to be consumed within 20 minutes of,
Yep.
fatigue or of exercise. Are you aware of that assumption and or any current studies that might contradict or support it?
No, there's support of that.
Yeah.
And generally, like you said, within that 20-minute window, you probably have heard that like chocolate milk is like the perfect recovery drink. Just the proportions of the different ingredients in it just helps that protein go to the muscle faster. I would say don't overdo it. And muscle growth comes with adequate protein and that adequate exercise in there. And so just making sure that you're getting both and you're not just relying on one or the other.
Again, salt and sugar are still my go-tos.
Are they-
They were all through the treatment too.
Other questions? Got time for one more question.
This has to do with Kevin's question. So you have your protein within that 20 minutes of workout, a shake.
Mhm.
Then do you go to your lunch or breakfast or whatever right after, or?
Yeah, that's a good question. I think it depends where, like when your workout falls into your day. I know some people work out first thing in the morning. They don't eat beforehand. Or some people, they can't work out without having eaten beforehand. I think, and my sports nutrition knowledge is not up there, but I think if you work out in the morning, it's good to have something in your stomach ahead of time. That's going to give you a little bit more energy to hopefully help you be more effective in your workout. If you're working out in the middle of the day or at night, I think it's just a matter of if you are eating protein, make sure that it's not really high in calories, and then making sure that you are factoring that into your next meal if you are eating shortly afterward. Because again, the overall goal is to make sure that our calorie consumption is not exceeding our needs. And sometimes when people do things like those protein bars or Gatorades or things like that, they do that on top of everything else they're doing, and they're not cutting back elsewhere. And so that can lead to weight gain. It might be slow, but that can lead to weight gain over the time. So I think it's just a matter of making sure you're compensating for that with that next meal or snack.
Great. Well, thank you, Crystal. Oncology, diet, nutrition, the role of a certified dietitian in oncology just can't be overstated. So important. And then just in general, we are what we eat, and knowing how we can avoid illnesses by eating healthy and recover from disease by eating healthy is part of an everyday lifestyle.
Mm-hmm.
So thanks, Crystal. Thanks, everyone, for joining us. If you know someone that might benefit from watching this, it will be available on demand tomorrow at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. Thanks for joining us. Please join us again next week. Thanks, everybody.